I have the great pleasure now of being joined by Dr. Soma Stout, the executive lead of the 100 Million Healthier Lives Initiative. Thank you so much for being here. It is so important, and it really is this movement to touch people's lives and make them healthier. How does that initiative really dovetail with the APHA and the campaigns that are also so important, the Healthiest Nation and the One Generation?
So 100 Million Healthier Lives and Healthiest Nation have a common purpose. I think when the Institute for Healthcare Improvement was thinking about how healthcare needed to shift to go from being a sick care system to a health care system, and when APHA was looking at how as a nation we have some of the worst health outcomes despite spending nearly twice as much on healthcare as other developed countries, we both came to a common aha moment that we needed to go from having healthcare over here and public health over here and social sector over here to really think how we begin to work together across sectors to create, as they would put it, generation public health or health system. That made us both realize that we needed to come together to join forces to figure out how to create this transformation and to bring the different agencies, the groups, everybody working on the ground to create the outcomes we're all looking for to help them all be much more effective and to learn how to work together.
Right, and working together, I think, is the key to that success. The Affordable Health Care Act really started that. You have such a unique perspective because you're working on this large initiative, but yet you're also a primary care physician, so you treat people. And how have things changed under the Affordable Health Care Act to sort of integrate that primary care and public health?
People think about the Affordable Care Act as simply a way of expanding insurance coverage. But if you really look at it, it's an incredibly powerful tool for transforming health systems and reforming the health system, because it changes the way healthcare is paid for in fundamentally different ways. And so an example of this, one of the things that the Centers for Medicare and Medicaid Innovation, for instance, have the ability and authority to do under the Affordable Care Act is to create global payments for health systems. And under global payments, instead of getting paid on a every time I see you I get paid and everything else that you need to support you in your health isn't covered, and so they're considered extra or nice things to do, it actually flips it and says, I get rewarded for keeping you healthy, and as a result of that, everything that I can do to help you stay healthy, including everything that we need to do across healthcare and public health. If you need help with housing or if you need help with learning how to manage your disease, all of that suddenly comes under the umbrella of what gets paid for. And it really sort of creates a policy change that's needed and the financing change that's needed to get us to a healthier nation.
Because all of those elements really have to do with people's health. In order to galvanize the troops, I think, you really need to think about not just the goals, but also what it would look like if you're successful. Can you talk about that a little bit?
Absolutely. So I think if you were successful, the world would be organized around you. And so what I mean by that is a person sort of customized for them and in their neighborhoods and in their communities, what you need to keep you healthy, whether you are a person who is 25 and doing well, and what the health system looks like for you, which may be very internet-based, may have a lot of telemedicine, et cetera, would be what it looks like for you. But if you're somebody with a chronic disease, you would have much more support at your fingertips to help you manage your life as you're living it and to manage your health and well-being as you're living it. But if you're somebody who is likely to experience poor health outcomes just for being born in a particular place, so there are cities where within 2 miles apart, a child born will have a 25-year difference in life expectancy. One of our goals is to really think about, I think in a future health system, your outcomes wouldn't be determined by your zip code or even by your genetic code alone, that everyone would have a chance to have the best possible health outcome.
And isn't that why you're all working together to try to provide that healthcare to people of all walks of life? Dr. Soma Stout, thank you so much.
My pleasure.